Metronidazole-associated encephalopathy. Background: Metronidazole-induced encephalopathy is a toxic encephalopathy associated with the use of metronidazole. Metronidazole is efficacious in treating trichomoniasis, amoebiasis, and giardiasis, and in infections caused by obligate anaerobes and microaerophilic bacteria.
I'm Dr. Greg Hall, and for whatever reason, your doctor or nurse practitioner has put you on Flagyl or Metronidazole. It's a medication they use to treat a wide range of things, but it's a medication that I thought it was worth doing a little video on just to make it clear. Sometimes they'll give you a big dose of it, like 2,000 milligrams, where they might give you 4 or 8 pills to take all at once. Other times, they'll give you the pill to take 3 times a day for a period of like 7 days. Either way, you'll want to take the pill however it's prescribed, which makes sense. Many of my patients will say that Flagyl or Metronidazole is a very bitter pill. What a bitter pill. Well, you're going to want to take it with orange juice or some kind of a juice because it has a bitter taste, and you're going to have to just get past it some kind of way. But just be forewarned that that's an issue. The other issue with Flagyl or Metronidazole is that it has an anti-abuse effect. Now, what is that? An anti-abuse effect is if you drink alcohol with Flagyl or Metronidazole, Flagyl, it's all the same. It can make you so you get violently nauseous and vomit. Okay, it's not going to kill you or anything, but at times you may wish you were dead. But it will make you nauseous and vomiting. So sometimes, they'll say no medication, no alcohol on my medications, and it may or may not be true. But with Flagyl, it's true. Do not drink any alcohol for days after you've taken it. If you take the big dose, you want to make 2-3 days after you take the big dose, and then certainly any time you're on those smaller doses, the 3-time-a-day doses, stay away from alcohol. If you don't, you will live to regret it. That anti-abuse effect is no joke. Okay, so that's our short little thing on Flagyl. Take it straight. It should clear up anything. It's a medication that's been around a very long time, very well tolerated. You'll do fine. For now, I'm Dr. Greg Hall.
Applications in medicine. A 58-year-old man with cryptogenic cirrhosis was admitted to the intensive care unit with confusion after a fall at home. He had been taking a prolonged course of metronidazole, 500 milligrams 3 times per day, for more than 3 weeks, for a Clostridium difficile infection. A few days before his hospitalization, dysarthria and gain stability had developed, which have contributed to the fall. A magnetic resonance imaging scan of the brain showed asymmetric enhanced fluid attenuate inversion recovery signal in the dentate nuclei of the cerebellum, a finding that is conscious in with encephalopathy associated with metronidazole use.
So, hello, everyone. My name is Greg Kearns. I'm the Chief Scientific Officer of the Children's Mercy Hospital in Kansas City, Missouri, and the Associate Chair of the Department of Pediatrics there. And I also function as the Director of the Pharmacology Core for the Pediatric Trial Network. In my opinion, it's the studies that we've done on metronidazole. And I'll give you the example. So that study started out a very good, concrete study. We wanted information in young neonates and infants about the pharmacokinetics of the drug because it had been understudied in that group. So there was an information gap. So a study was conceived, designed, conducted, the data were interpreted. And we found something that we could predict in a way that we've seen for many other drugs, and that's that the clearance of metronidazole changed significantly in that first few weeks, months of life. So that wasn't the whole answer. We asked the question, why? No, there was no answer. So then we got together people in the clinical pharmacology core with the lead investigator here from Duke. And we said, well, what studies can we do to find out? And we've done a series of studies. We characterized for the first time the metabolism of metronidazole in human cells, tissues. We found a surprise that we're getting ready to publish, so I'm not going to publish it in advance by saying what it is. But then we looked at another step at the differences in the metabolism, the breakdown of that, and we found that there was a switch of two different drug metabolizing enzymes, a switch that occurred that no one had ever discovered before. So for one seemingly straightforward, very good study that we thought we had the answer that we needed, we've now opened up a whole line of not just inquiry but some answers about an old drug, but a drug that's incredibly useful today. And that's the kind of stuff that we leverage in the Pediatric Trial Network. That's what comes from when you take a group of people whose backgrounds and their training and their expertise might be a little different, and you amalgamate them into this whole big group of clinician scientists capable of asking and then answering the right questions. So that's a great success story.
Pros. Metronidazole is used to treat a variety of infection. It belongs to a class of antibiotics known as Metronidazole. It works by stopping the growth of bacteria and protozoos.
This is Doug Brunk for Global Medical News Network. Results from a new study found that oral metronidazole was just as effective as oral vancomycin for treating Clostridium difficile diarrhea, regardless of the severity of illness.
As we all know, antibiotics, which is used for different infections, can cause different side effects. And antibiotic-associated diarrhea is one of the most common side effects caused by Clostridium difficile, C. diff. And so the C. diff treatment guidelines from IDSA is published in the month of May last year, 2010. So as per the guidelines, the infection can be classified into mild infection and severe infection. So our objective was to look at the patients who receive both and look at the outcomes, which means complications and recurrences.
So based upon this data, we come to the conclusion that metronidazole was non-inferior to vancomycin, irrespective of the severity of illness. And the rate of recurrence there's no difference between the rate of recurrence between metronidazole and vancomycin groups, irrespective in severe illness. While in non-severe illness, there was a difference. And there was no difference in the rate of complication between both of these two groups. So based upon this data, we had some limitation that it's a retrospective study, and it's a short, small population size. And in our study, because of the Veterans Affairs Hospital, so majority of our patients were males. So we don't have many of the females. We only have 2 females, mainly in the metronidazole group. So based upon this data, it's hard for us to draw a clear-cut conclusion because of retrospective analysis, but still we are posing this question to healthcare professionals: that is the managed treatment for the Clostridium difficile diarrhea, especially in severe illness, is vancomycin justified for it, especially in this era of healthcare when the cost effectiveness is very important. So same management with metronidazole can be much cheaper as compared to vancomycin, which can be much more expensive.
Cons. Metronidazole may produce a number of neurologic side effects, such as cerebral syndrome, encephalopathy, seizure, autonomic neuropathy, optic neuropathy, and peripheral neuropathy. The exact incidence of this rare event is not yet ascertained.
This case represents a subtle incidental finding in a patient with a history of chronic liver disease and clinically evident chronic hepatic encephalopathy. You see that there is increased intrinsic T1 signal in the basal ganglia, particularly the globus pallidi, that additionally extends into the cerebral peduncles of the midbrain.
appreciable signal abnormality in the remaining MRI sequences obtained. This appearance is thought to occur secondary to portosystemic shunting and deposition of various substances within the brain, including manganese, which causes T1 shortening effects. Although not seen in this case, acute hepatic encephalopathy may be associated with more extensive findings of diffuse cerebral edema. Following liver transplantation, these signal changes may eventually resolve. Other general differential diagnostic considerations of intrinsic increased T1 basal ganglia signal include basal ganglia calcifications, changes associated with hyperalimentation, Wilson disease, hypoxic ischemic encephalopathy, carbon monoxide poisoning, and kernicterus in newborns.
Conclusion: metronidazole may produce neurologic side effects such as cerebral syndrome and encephalopathy in rare cases. Encephalopathy associated with metronidazole use is an uncommon side effect of the medication. It typically manifests as dysarthria and gain instability. Risk factors include liver dysfunction and a prolonged course of metronidazole. Typical cumulative dose for more than 20 grams.
Hi, Dr. Goldberg here, continuing our infectious disease lecture series. Today we're talking about Flagyl or metronidazole. We have a case of a 21-year-old sexually active female who presents with a very odoriferous vaginal discharge, smells very fishy. She has the positive whiff test, and vaginal stains show clue cells. You diagnose bacterial vaginosis and place her on metronidazole, and she gets better. The next day, you're working in the health department and diagnose a patient who has trichomonas vaginal infection associated with a strawberry appearing cervix, and treat the patient with metronidazole also. So metronidazole has been an antibiotic that we've used for decades. It's an excellent antibiotic. It's in the nitroimidazole class. It acts by forming ether bonds with cysteine-containing enzymes in the organism by being reduced to nitroso intermediates. It's certainly one of our best anaerobic antibiotics below the diaphragm, very effective for Bacteroides fragilis and other anaerobes. Unfortunately, above the diaphragm, it's got very poor lung penetration, but it's also good for certain protozoa, such as Entamoeba histolytica, as we mentioned, trichomonas, and then very good for Giardia. We've been using it for years for Clostridium difficile diarrhea, as well as rosacea, and as noted in our case presentation, bacterial vaginosis, or BV. Watch for adverse effects, which include a bad taste in the mouth, a disulfiram reaction with alcohol use, central nervous system changes or neuropathy changes, and then, of course, GI side effects. The dosing is 500 milligrams, generally 3 times a day orally, or IV, and 0.75% topical. So this is just a nice review on the antibiotic metronidazole or Flagyl. It's got a lot of uses. Be aware of these. Thank you, Dr. Goldberg, signing off.
Thank you.